This is Jason Vitello. I am the Behavioral Health Coordinator for Denver Public Health and the Director of Health Equity for the Colorado Public Health Association. Welcome to our April Health Equity webinar. I'm very honored to introduce a dear colleague, Dr. Vincent Atchity. He's the recipient of the 2016 Excellence in the Promotion of Health Equity Award by CPHA, CIHA, COSOFI, and PANAC. He's also the Executive Director of the Equitas project. It's an initiative of the David and Laura Mirage Foundation. Equitas is a nonpartisan, nonprofit organization that focuses on disentangling mental health and criminal justice. Gwendolyn West, who's an active member of our Health Equity Coalition, is our project coordinator. I was very humbled and honored to have been a participant at the 2018 Course Corrections Steps to Health and Justice Summit, where experts and leaders in health, safety, and criminal justice from all over Colorado gathered to discuss alternatives to incarceration and criminal justice system involvement for people living with mental illness. Vincent will be discussing the resulting recommendations, call to action, and next steps. Vincent, I'll pass it on to you.
Thank you, Jason. Thanks for the kind introduction and for having me with you today. I'm grateful for the opportunity to share this work with the public health world in Colorado. I'm just going to begin with just a little bit of background about Equitas. As Jason mentioned, we're an initiative of the David and Laura Mirage Foundation, and our vision is an America that is rededicated to the notion of liberty and justice for all, and a place where we share the expectation that jails and prisons should not continue to serve as the nation's warehouses for people with unmet mental health needs, which is unfortunately currently the case. In most states in the country, jails and prisons are the largest psychiatric facilities, and a great deal of our current mass incarceration is driven by unmet mental health needs. So we're a nonpartisan organization focused on disentangling mental health and criminal justice, which is a complicated thing. And I'll share a little bit about that with you, as well as progress we've been making lately. Thank you again to our founders and primary funders, the David and Laura Mirage Foundation. With this public health audience in mind, I am particularly sensitive to what I've perceived over the course of travels around the country and around Colorado as a shortage of public health workforce and public health project commitment to working at the intersection of mental health and criminal justice. And so I want to just sort of take this opportunity to elevate these concerns in your eyes by just pointing out the prevalence of mental health as a concern throughout our population. And, you know, I often think that mental health is sort of our unacknowledged #1 public health crisis in this country, and we have a hard time seeing it on the landscape of health concerns, sometimes due to some stigma perhaps that's still attached to mental health issues, but also due to the fragmentation of those issues into so many of the ailments and discomforts and diseases that affect the well-being of our population, you know, ranging from, on the sort of lightest side, as heavy as it is the loss to productivity across the economy thanks to depression and unmanaged depression. That is one of the health conditions that takes the single largest toll on absenteeism from work and lower productivity. But then sort of moving through the spectrum, mental health is also encompasses teen suicide, and it encompasses disruptive classroom behavior. It encompasses substance use disorder, the opioid epidemic, the heightened rates of sort of middle-aged male suicide, which characterize Colorado among other things, domestic violence. There's just so much about mental health that is damaging to our well-being that it's kind of hard to keep track of it in the landscape unless we remember that the brain is part of the body, and the brain is one of the parts of the body that is most susceptible to toxic environment and all kinds of things that play into the production of behaviors that are driven by unmet health needs. So, you know, just scanning through the some of the things we know is how prevalent it is. You know, 1 in 4 people will experience a mental health crisis in their lifetime, and nobody's got mental health that is always on an even keel. Everyone's mental health oscillates in a kind of up and down kind of way, not just over the course of a lifetime, but over the course of months, weeks, and even days. And it's when people's mental health takes a downturn that the symptoms of that disorder tend to manifest themselves in crises that provoke engagement with first responders in one way or another. So it's really prevalent, and there's all kinds of issues that complicate the landscape of mental health management in the state of Colorado as well as in the country. You know, among other things, Colorado has been ranked recently by Mental Health America as 43rd in the country for mental health care need versus access. We have a serious workforce shortage. Psychiatrists and behavioral health clinicians are hard to find and hard to keep in Colorado as well as other states around the country. There are serious concerns about the level of need versus care. It's suggested that something like 57% of people in Colorado who needed mental health treatment did not receive it. And what happens is a lot of the unmet mental health need ends up being managed by a justice system because the first responders are often police to these kinds of crises as well as to other sorts of crises. And because we don't have adequate mental health preventative measures in place, nor adequate mental health intervention measures in place, the police end up transporting people in handcuffs and often charging them with crimes that are not so much a consequence of criminal decision-making and dedicated criminality, so much as bad decisions, risky decisions, and other such things made during the health crisis. So there's a magnitude of concern that should pretty much be on everybody's radar, since, to my mind, a nation that defines itself as land of liberty, none of us should have to want to mutter under our breaths and acknowledge that, as it turns out, we're actually the incarceration nation with a higher rate of incarceration than any other country on the planet. We're something like, we represent only 5% of the world's population, but more like 25% of the world's incarcerated population. And just having to acknowledge that terrible gap between who we think we are and who we actually are is a kind of mental health crisis on a public scale that we should feel an urgent compulsion to address. So a lot of our work in the last several years has been focused on activating leadership, heading us in the right direction, and making recommendations and pointing the way to an improved landscape for mental health, as well as a reduction in incarceration. And important for sectors across the community to share a notion of where we want to be headed in terms of the cultivation of a community that is healthy and safe and prosperous. And it's not entirely where we are right now. And it's important to recognize that we've got sort of two things going on. And one is a very overcrowded justice system with juveniles and adults at a high rate involved in this justice system, many of whom need mental health support and care. and are not able to get it to a standard that sort of meets a standard of quality that should be acceptable given the high standards of quality for other sorts of medical care in this country. So on the one hand, we've got this population of justice involved folks and a number of initiatives that need to support their well-being. And then we also, as public health folks, need to be thinking about the long-term health of the population and focus upstream on what are the sorts of things that we can be doing better collaboratively as a community to support the healthful development of people before they ever risk involvement with the law enforcement or the justice system. So we need to have a longer term view of a population health measure, as in most things, and get going immediately and be sensible to the kinds of indicators that in 5 years' time will tell us that we're on the right track. You know, one of those is sort of a shared, increasingly shared focus across all sectors and systems on mental health and supporting mental health, sort of a translation of Americans with Disabilities Act to be fully inclusive of people's mental health needs. That's not just a matter for public health or for health care, but every sector of the community needs to be more widely aware of that. And that would be a good indicator that we're on the right path in 5 years. We also should have a strong sense of what mental health measures are, both on an individual basis and on as we track cohorts in the population. I'll say a little bit more about that as we go along. And we should also, part of that awareness of mental health should include a more universal practice of assessing mental health, assessing each other's mental health, assessing our own mental health, assessing loved ones' mental health, and some increased fluency in knowing how to provide support and provide referrals when appropriate for additional support. We're good at being able to tell when somebody is choking at the dinner table, and many of us are familiar with the posters that tell us how to apply a Heimlich maneuver to make a first stage intervention at that crisis. We should be similarly fluent in recognizing mental health distress and in providing helpful remedies. You know, we should also have a clear idea of where we want to be in 15 years' time. And in 15 years' time, to put it simply enough, I would say that today's 5-year-olds should be involved in the justice system at a dramatically reduced rate when they're 20 years old. And so the place to start is with early childhood and the eye on the ultimate target of radically transforming the health aspects of the justice system so that when people are engaged in the justice system, they're getting the sort of corrections that are needed in order to support healthful reintegration in the community. This slide may be a little bit hard to see, but it's a sort of a population health scheme that shows the different points along a lifespan where interventions in supporting the mental health of people are critical. And so along the top track here of this 2-tracked scheme, we have childhood, healthcare, education, employment, and housing, sort of just recognizing and promoting the understanding that each of these places are critical focus areas for supporting the health of individuals and populations. There is no dispute, essentially, that one's early childhood years lay the groundwork for later successful development, both physical health and mental health. And so every effort to invest in assessment and intervention that is supportive of health at that focus point is very valuable investment in terms of later payoff for the health of the population. Healthcare is, of course, essential, and access to behavioral health assessments and care should be every bit as regularized as access to the pediatrician or for your yearly wellness exams on the physical side of things. The educational system has to be accommodating of people with health needs and must be focused on realizing the potential of every human charged that's charging through that process, and every effort made to make sure that education is leading to success in the community and not a pathway to failure and involvement in the justice system has got to be emphasized and prioritized in communities. Employment has to be supportive and accommodating to people of all kinds of varying abilities. And we absolutely need to address the shortage of affordable and supportive housing, especially with regard to people whose mental health illnesses may make it especially difficult for them to maintain stable housing. Stable housing is a fundamental health need and shouldn't really be seen as anything else. On the second track of this, we have reflected a justice system which is always going to be necessary given the nature of humans. And the features of that justice system are the public safety intervention point, the justice system itself, the court system with the prosecution and the defense and the judges, and then the correction system where people have been sentenced for offenses and are deprived of liberty in order to be corrected, for justice to be administered, and then the reentry piece of it, which is where folks are returning to the community after having served a sentence fitting to whatever offense it was. These things are all necessary and will always be necessary. The problem right now is that this is where the bulk of our investment in mental health is taking place, is along this secondary track of things from public safety through justice, corrections, and reentry. Ultimately, what we're arguing for and working with communities to do is to promote a rebalancing of investment so that we are investing more mindfully and in a more coordinated way in childhood, in healthcare access, in education, employment, and housing. These are the investment points that yield healthy, productive, prosperous populations. The current imbalance of spending billions and billions of dollars every year on public safety, justice, corrections, and reentry is a mis-expenditure of resources that does not yield good outcomes, either for health or for public safety. So that's really the massive sort of rebalancing and refocus that we're talking about. And it's a lot, and it's maybe a bit daunting, but I think that a public health community ought to be especially aware that you can't be daunted by big problems or stumble on questions about where to begin or what priorities are and how do we possibly wrap our arms around all of this. It's a lot. I get that. And that's why this next slide is sort of the pause to just sort of refresh. It's a prosperous, growing field of corn planted here, which is just a little bucolic moment in the scheme of this. And where to begin? What are the priorities? Well, to use a farmer-driven metaphor, I like to get people to think about how many seasons it takes. If a farmer is cultivating a bunch of acreage and trying to grow corn on that acreage, and they've planted it all, and they prepare the soil, they plant it all at the right time of year, and then they're irrigating and waiting for things to come, and they discover at the end of the first season that a quarter of that acreage is failing to produce. The plants are withered or unproductive. How many seasons does the farmer let go by before they examine that quarter acre to see what's going on? My argument, which has yet to be contested in rural settings, is that a farmer doesn't let us more than a single season go by. They walk down there immediately as they see that there is an unproductive quarter acreage. And sure, they think about where to begin, and sure, they think about priorities, but they acknowledge that there's a number of places and a number of priorities when it comes to trying to produce thriving crops. They look at the air, they look at the water, they look at the sunlight, they look at the quality of the wind that's circulating through there, and they start making adjustments immediately. They begin with what they've got. And the best place to answer that question of where to begin to try and make this shift away from being the incarceration nation and toward being a nation that has liberty and justice for all and prioritizes mental health as a key public health initiative is to begin where you are. And that may just be being aware of this and being able to tune in to opportunities to advocate for increased activity along a series of fronts that I'll get to in another moment. But just begin with where you are. And one of the key things for public health folks to know is that we've got an interesting shared understanding with allies on the justice side of things, but we use two different languages. In the public health world, we're familiar with social determinants of health and understand that, you know, genetics certainly contribute to health outcomes in the long term, but we also have other factors like individual behavior and the sorts of environments that we live in, which condition health outcomes. So we don't attribute a health outcome to any single thing. We look at a composite picture that dictates a health outcome. On the criminal justice side of things, they also recognize a composite kind of picture that, to their mind, heightens the risk of somebody's involvement with the criminal justice system, but the language they use is different. They call them criminogenic risks. But what they talk about are things like family and marital stressors. They talk about cognition issues. They talk about lack of pro-social engagement with the community, lack of employment, lack of education, substance use. These are social determinants also. The point is not to teach each other's jargon, but to recognize that human health is the product of a number of things and requires support from all sectors for the health of the population. We want that blighted quarter acreage to thrive as the other 3 quarters do, then we need to get in there and use every tool at our disposal to support the health of the individual plants growing there. So what we've been doing is convening these stakeholders around the state over a period of time, and as recently as October, just before the election this past year, we reconvened leadership, and they produced a sort of revised version of a document that was initially produced in 2016. And this document, which was called a course corrections document, declared straight out that the state of Colorado is in the midst of a public health crisis and points out that it's Coloradans with mental health needs who are too often neglected, stigmatized, or inadequately supported, and that failure to address these health needs results in premature death, injury, substance use and addiction, long-term disability, and many other preventable threats to public safety and well-being. Where our public health, one of the places, there's so many places where our mental health crisis hurts terribly, suicide and drug abuse, included among them, but one of the places where it plainly hurts the most is where it results in this over-reliance upon the criminal law enforcement system. And the document goes on to point out that the arrest, punitive detention, and criminalization of Colorados with unaddressed health needs gravely exacerbates this crisis, is a wasteful misapplication of resources, and yields poor health and public safety outcomes at tremendous cost to individuals, communities, and the economy at large. Folks who participated in the conversation resulting in this statement and the recommendations that follow include some of the state's key leadership at the intersection of mental health and criminal justice, our state directors of public safety and corrections. We had behavioral health leadership. We had law enforcement leadership. We had advocacy leadership and sort of health alliance leadership, county commissioners, county sheriffs, a very strong array of leaders who agree about these things. This is a consensus document. Over the course of 2018, we conducted a series of regional stakeholder meetings all over the state of Colorado and brought together district attorneys, public defenders, sheriffs, police, judges whenever we could get them, and behavioral health providers to keep a spotlight on the intersection of mental health and criminal justice and to hear about persisting barriers to improvement as well as initiatives that were underway. We did this in order to support continued focus on this intersection as the state leadership was transitioning during the election year. We've had, in a divided time, we're optimistic because not just in Colorado, but nationwide, the bipartisan commitment to this particular issue is uniquely strong. Every single initiative has had strong support from both Republicans and Democrats, as all recognize that mental health and our current management of it negatively affects all of us. Common themes have emerged over the course of these conversations, which are reflected again in this series of things. And then I'm just going to get right into some of the recommendations that are made in the document. I'm not going to go through all of it. There were a lot of them, but they break down into these categories, starting with childhood and youth. Again, recognizing that supporting mental health awareness and the development of healthy behaviors in early childhood is vital to lifelong well-being. Some of the recommendations are made, including that we need to focus on expanded access to mental health awareness education, support and care for children and their families. Addressing children's needs alone is not enough. Two generational models of acknowledging that children are heavily influenced by their family environments means that we as public health folks need to address the entire ecosystem that yields the mental health outcome and not isolate people. The state should be focused on setting standards and expectations for the inclusion of wellness support services, education, and curricula in all child care settings. There were 3 other recommendations. I'm not going to go into all of these in the document. The document is available. It's been published. It's available on our website. There'll be a link later in this set of slides that you can follow. It's also key that we provide, one of the recommendations that we provide early identification and treatment of trauma and adverse childhood experiences in child care, preschool, and healthcare settings. As many of you in the public health world are familiar with, this notion of adverse childhood experiences has been increasingly gaining traction and acknowledging that as a person's exposure to adverse experience in childhood increases, so does their likelihood of later involvement with the justice system and other poor health outcomes. And the best time to address an adverse childhood experience is as close to that experience as possible in order to maximize the resilience of developing human. So it really can't be emphasized enough that if we want to see a changed landscape in 15 years, every initiative directed toward children ought to be tracking justice involvement in a longitudinal way and be targeting those kinds of outcomes, amongst others. There were 9 recommendations that this group of leaders made regarding healthcare and healthcare transformation, based on the observation that individual access to healthcare across the lifespan builds community well-being, and preventive and supportive healthcare is more cost-effective and yields better long-term outcomes than waiting until acute crisis care or long-term care is needed. That is as true with mental health as it is with every other kind of health. Mental health may be the most important kind of health. One of the key recommendations is that Colorado, which has enjoyed such a growing and booming economy over recent years ought to embrace as a state goal the investments in training, deploying, and retaining a world-class healthcare workforce that provides preventative and supportive care for Coloradans' minds and bodies, as well as youth engagement, education, access to services and resources, and crisis response. Train all clinicians and first responders on mental health, addiction, and trauma needs assessment, and on pathways to support and care. One of the greatest frustrations in accessing care for mental health concerns is running into wrong doors when access to care is attempted. People are turned away if they don't meet certain eligibility criteria. Primary care physicians don't always screen for behavioral health needs and vulnerabilities. That's got to change as public health people understand the best. Health, as soon as we start dividing it into body parts, we lose track of health. And the last body part that should ever be excluded when anybody walks into a door trying to access care is the health of the most important organ in the body, which is the brain. And yet that's where we are. And so, you know, there's so many interesting workforce phenomena associated with that need to be addressed as we try and transform that workforce. For one of the characteristics of that is the segregation between training for providing care for a whole set of mental health disorders, and then segregating out the training of how to provide care for substance use disorders. As practitioners and first responders know, it is impossible to separate out mental health from substance use disorders. Substance use disorders are a mental health disorder and are often coexist with other diagnoses as people medicate themselves for things. So there's something distinctly absurd about being able to be trained in psychiatry, but not addiction, the disease of addiction, and that should be remedied at the curricular level. At the delivery level, there should be no wrong door for accessing care. If you are intoxicated and suffering with a substance use disorder, you should not be turned away from mental health care when you're seeking it. There should be no wrong door. So there's a variety of other recommendations around healthcare that extend beyond training and retaining that world-class workforce and focus on investing in accessibility to a full continuum of healthcare, incentivizing brain behavior and trauma research. This is, as the most complicated organ in the body, it is one of the least understood. It's one of the last frontiers, really, for medicine, and the current state of mental health care reflects that it is not up to par with our level of care for cancer, for example. And some of the smartest minds in the country ought to be incentivized to turn their attention to this matter. What else? Other healthcare recommendations include the universalizing of home visiting nursing programs, such as the Nurse-Family Partnership to households after births, to provide that kind of initial level of screening and support for developing people's health needs. We need to fund a world-class addiction, pain management, and mental health treatment system. And we need to be standardizing routine, culturally competent, and trauma-informed patient education in self-care and screenings for mental health needs in all primary care settings. There were 7 recommendations from the group regarding education. Education is a key factor in promoting better individual health outcomes in communities. Ensuring access to supportive educational programs for students of all ages and guaranteeing access to education for incarcerated citizens will yield cost savings and a more robust economy. One of the recommendations includes recommending that we cultivate literacy regarding wellness and make resources available to support wellness among students and families. Everyone should have a mental health plan and a personal diagnostic and first aid toolkit, as well as an advance directive regarding care preferences in case of health crises. That advance directive is possible thanks to the passage of a recent bill that creating the psychiatric advance directive. It gives people an important opportunity to be able to specify what works and what does not work for them in crisis so that responders know how best to intervene. Yeah, so there's so many things to say about education. You know, one of the other recommendations is that all teachers and school administrators be trained in trauma and trauma-informed classrooms and evidence-based practices. It's too easy to sort of exacerbate trauma by taking an uninformed approach to a disruptive behavior. At-risk youth that are identified in the school system need to be valued for their potential and connected appropriately to the sorts of support and care which will yield them as successful and productive members of our community, rather than being hastily judged as bad kids and sent down a route into juvenile justice and later adult justice involvement. It's a terrible thing to mistake a bad behavior and a disruptive behavior for criminal intent and derail the course of a human being's entire development. And it's especially terrible when that happens in the context of schools, which are designed to be supportive of human development. So ending the use of harsh, inequitable discipline in schools has got to be a priority and has been included by these authors in this document, that we reform school discipline policies to ensure that behavioral concerns, especially those related to substances, mental health, trauma, and other adverse childhood experiences are addressed from a healthcare perspective and approach. There were 3 recommendations made in the area of employment. One of them is that we take steps towards ensuring success of every individual by providing training, internships, apprenticeships, and supports for people with mental health needs, as well as for those who've been involved in the justice system. A brush with the justice system should not mean that your life is derailed forever. That is not justice and is not proportional to whatever the offense was. What we forget is that 97% of people who are sentenced to prison for a crime for which they've been convicted will return to the community. And we have named that system corrections, with the expectation that corrections are taking place there which strengthen the person, make them more able to succeed in integrating in their community. A key piece of that, none of us succeed without employment, and so pathways to employment need to be smoothed and cleared, and recognize that just as housing is a fundamental health need, for most humans, employment is also a fundamental health need, not just for the sake of the income, but also for the sake of fully engaging us with our lives and our communities. A key area of focus in conversation for this leadership group was on housing. As I've mentioned now a few times, there were 3 recommendations made regarding housing. One is that we expand integrated housing programs to support individuals with complex health needs. A lot of our homelessness is driven by unmet health needs, as well as by the affordability of housing. If we were to invest in creating permanent supportive housing more consistently and at a level that would meet the actual needs of the population, we would save a great deal of money misspent on jails and in prisons. and also yield much better health outcomes and do a lot for the well-being of our community. Colorado has made good progress in acknowledging that housing is a critical health need, and steps have been taken in every region of the state in that direction, but it still falls short of where the population needs are, and so this just needs to remain on the radar as a priority. And an additional consideration, especially from a public health focus on housing, is what is integrated housing and how does that work? And as public health folks may understand best, it's not about isolating people in far-flung places or edges of town. It's about full integration in communities and making sure that there is meaningful, useful transportation, meaningful access to care, meaningful access to employment, and as much full integration with the community as possible, and thinking a little bit about what it is, how you go where people are living and making those communities more healthful and more supportive of persisting living in those communities, even with mental health needs. A number of recommendations, there are 6 recommendations altogether with regard to public safety. One of the key observations from the perspective of a public health person is that our chief allies, as it turns out, in disentangling mental health and criminal justice tend to be folks in public safety in the justice system. Police, sheriffs, judges, public defenders, district attorneys, these are some of the members of our communities who understand best that they're dealing with epidemic levels of population need, and they're dealing with them with the inappropriate tools of a justice system. And much of our work and much of the thrust of this kind of a document, this document and others like it that we produce, is kind of a call to action from the perspective of the justice side. Calling for additional participation from the other sectors of the community that can provide the kinds of preventative supports that would support health and prevent justice involvement. One of the recommendations from the public safety section is that we shift the response to substance use and addiction from public safety and law enforcement to healthcare, and ensure that people in possession of or using substances are directed to treatment and recovery with the goals of decriminalizing substance use disorders, reducing harm, and improving outcomes. Too often, people with substance use disorders are arrested for this health need, incarcerated, and return to the community without the health need ever being adequately addressed, resulting in a return to the substance use disorder and then repeated cycles of incarceration. It doesn't work, it costs a lot, and it's not the standard of care that we would expect for treatment of any other kind of health disorder. So we have to get up to speed with that. Public safety, it's also recommended that we continue to work toward universalizing crisis intervention team training, community policing, and co-responder models to redirect people toward healthcare and to minimize arrests. One of the most important points at which to minimize arrest is at that very first point of contact. Anybody who's being arrested for the first time and is for some kind of an action that may be health-driven ought to be given priority consideration for redirection toward healthcare. One of the best preventions of later justice involvement is reducing the extent to which somebody's first justice involvement is a deep involvement. So as much redirection as possible there. There's, again, a number of recommendations made in the scope of the justice system. One being that we work to improve the process of civilly committing individuals to least restrictive outpatient or inpatient care when their health is the primary driver of unlawful behaviors. And this sort of acknowledges that while we want to redirect people away from criminalization and incarceration when they have unmet health needs, it does acknowledge that for the sake of both safety and health, there may need to be some kind of compulsion involved in that pathway to health care, hence civil commitment and a revisiting of how that works. And you know, commitment does not need to be inpatient commitment. Depending on the level of need, it can be outpatient commitment, but that kind of stipulated involuntary involvement with healthcare may be a necessity in some cases, and that needs to be managed carefully for the sake of preserving civil rights and prioritizing health and the well-being of individuals, their families, and the community. There are a number of other justice recommendations, including the recommendation that we work to pass a bill to end mandatory minimum sentencing for people with unmet health needs. There's a recommendation that all judges be trained to assess law enforcement and justice responses to health-driven behaviors and crises in light of parity. Mental health and physical health-driven behaviors and crises should meet with equivalent compassion and intelligence. Health needs and root causes should be addressed before people are judged as criminals. There were also recommendations made regarding corrections. One of those is that we expand case management within corrections before parole to ensure continuity of care, successful community integration, and department accountability for improved outcomes. It is the track record for people who are released from corrections without continuity of care or a re-entry plan is not a good track record, whereas that more deliberate kind of case management that begins during the course of the corrections enhances outcomes and needs to be implemented across the system. Another recommendation in corrections is prohibiting the use of prolonged solitary confinement. Solitary confinement, all mental health advocates agree, exacerbates mental health distress, and if you're not in mental health distress, solitary confinement will often produce mental health distress. It is not all that surprising. Under reentry, the partners have recommended that we partner across sectors, again, to ensure that continuity of access to services and resources that individuals need for the sake of stabilizing and thriving in the community. Reentry also requires access to affordable supportive housing, a lowering of barriers to employment and education, ensuring the continuity of healthcare. It's in all of our interests to make sure that our corrections system is truly an aspect of a justice system so that folks who have been corrected by our community are welcomed back into the community and not permanently damaged as a consequence. And then finally, data is a key area for our work at the intersection of mental health and criminal justice. Data is not abundantly available, and it is not well integrated. One of the observations that comes as a surprise to many is that there's pretty much nobody in the state of Colorado right now who can tell us how many people we have in our county jails, because there is no centralized system which tracks all of that, nor which tells us which of those people have mental health needs. Now that we live in this data-rich environment and reflecting moves towards integrated use of data across health systems, we need to continue to pressure those systems refiners to include behavioral health in that scope of things. So just to wrap up, the work that's been done by these leaders in producing these recommendations extends beyond the production of the recommendations themselves to a more generalized impact on changing the culture in the state. Many of the folks who have participated in these discussions around the state in the regional meetings and since 2016 at the statewide level are the very same folks who are involved in our legislative process, either as the drafters or supporters or testifiers in behalf of or against certain bills that have been proposed. And over the course of the last 3 years, our legislative progress in Colorado has been considerable at the intersection of mental health and criminal justice. And just to sort of run through a few of the things that have emerged in the last few years, one of the key outcomes in 2017 was ending the use of jails for mental health holds. Colorado up until then was one of the remaining 6 states in the country that would use jails as holding cells for people who had no criminal charges, but had been placed on a mental health hold out of concern for safety and health. And that was arguably a civil rights violation, a human rights violation, and there was broad consensus across all sectors and parties that had to go. So that was a great accomplishment in 2017. 2017 brought a number of other legislative successes amounting to more than $44 million in state funding, ranging from enhancements in childhood and school counselor early support for children to enhancements and funding for housing for mentally ill folks returning to the community after an experience of incarceration. 2018's session added additional significant successes to the state's efforts to address and disentangle mental health and criminal justice with additional $14 million or more in state funds, expanding jail-based behavioral health services, and also uniquely and interestingly creating a statewide court liaison program so that every judicial district in the state has an expansion of their workforce, which includes a liaison who can be a source of information to judges and decision makers in a legal process so that they are aware of what community resources there are for the sake of supporting redirection of people into healthcare. All kinds of other good things afoot. 2019, we're still underway with what I've heard other advocates describe as maybe the most significant legislative session in 10 years of Colorado legislative history for the sake of mental health. So all of the wheels are turning in the right direction in our state, but this is a massive sea change that's underway and requires, again, this kind of attention and investment of effort and thoughtfulness across all sectors, and no one better than the public health partners to be promoting a focus on these kinds of initiatives in their communities or in whatever their area of work. So that is pretty much all I was going to share with you today in terms of an overview of this work. I'm not sure we're structured in this webinar to take questions.
Yes, we are. Thank you so much, Vincent. We really appreciate all that you've shared today. And as Amy just noted in the chat box, the legislative slides really emphasize how much has been accomplished. So thank you for sharing that with us as well to sort of bring us into the action orientation of this work as well. We're going to open up. We have just a few minutes left. So if anybody would like to ask a question to Vincent, you can feel free to unmute yourself, or if you're having trouble unmuting yourself, there's a button that says raise your hand next to the participant list. And also type your question into the chat box if you would prefer it to be read to Vincent. So I'm going to give folks a minute if anybody would like to ask a question directly to Vincent on the webinar. Well, Vincent, I don't see anybody currently raising their hand. So I'm just going to say a wonderful thank you from all of us for sharing all of your work today. Did you have any last comments you wanted to share with everybody?
Just this is that one of our key areas of focus is learning how to optimize new partnerships with people. So if anybody is ever interested in discussing possible pathways toward collaboration on this front, please reach out.
Wonderful. Thank you so much. I've pasted both Vincent's email into the chat box as well as my email if you're interested in a copy of the slides and or the recording. So feel free to reach out if you'd like those types of materials. Vincent's information is also currently on the slide. So thank you everybody for joining us over your lunch hour. We appreciate your time and hope that you took away something to share with your peers and your colleagues. So thank you again for your time. Have a great rest of your day.
Thank you.